So the majority, 57%, are saying no capacity change.
Wow.
We have 14% who have said they've had a small productivity reduction. 29% are saying a significant productivity reduction, and no one has had a capacity increase.
Thanks, Keith. So I'd say that has a lot to do with the large number of life sciences companies we have in the room today. We need you. We need your products as a result of this. So that's encouraging to hear. So I'm going to shift gears now. I'd like to invite the panel to join us on video. So I'm going to be bringing up to this virtual stage Mel DeJesus from Jazz Pharma, Lynn Harris from Sunovion, Colin Davidson from Astellas, Ralph Nip from Astra Zeneca, and Robert Yu from J&J. Maybe while we're getting assembled, Dave, do we have any questions from the chat that maybe we can take a question or two before we kick the panel off?
Yeah, sure. There was one question that came in. It was asking basically, how do you find the bottleneck part of your organization? Is there an easy way, or what techniques do you use to find that bottleneck organization?
That's a great question. Thank you. So for those of you that have a tool like Planisware or a PPM system, and when you're loading your supply and demand, it'll be very noticeable when you break it out by function, which functions are constantly, chronically outstripping their capacity with a need for more resources, not only in the long term, but in the medium term and short term. So if you keep your data up to date and your product data is reasonably accurate, it'll stand out. But more than that, I think turn to your project leaders, your program managers, because they will candidly tell you they know which functions are the bottlenecks on their particular projects. So if you have a PMO where your project leads get together, they have that visibility where if they're all saying the same thing, it'll rise to the top very quickly where that bottleneck resource might be. And what I've noticed in functions like regulatory affairs or quality, just as an example, you typically have a small number of people working on multiple projects. They rarely dedicate they don't have the luxury of being able to dedicate a person to each project. And I'm generalizing across industries and across the different companies I work with, but that's what I found to be the bottleneck function. So we'll have time for questions at the end of the panel.
Yeah, definitely. Sounds good.
So let's turn to our panel. So thanks guys for joining us. We've got 4 biopharmaceutical companies and 1 in the med device space, and Robert at J&J. Let's start off with this question. Has your company conducted a portfolio rationalization or rebalancing as a result of the pandemic? And what are maybe the 1 or 2 big lessons you've learned from that exercise? I'm going to maybe just randomly turn to Ralph to get us started.
Sure. Thank you, Noel. So the simple answer to your question is yes. We have done a reassessment of the portfolio due to COVID. And actually, one of the big reasons for that is the need to actually add priority to new projects that have come about as a result of working on COVID, whether that be antibody collection or vaccine development. So we definitely have had to quickly introduce items into the pipeline and the portfolio, and obviously that comes at some expense. So we've had to assess which projects will need to be downgraded to make those things happen.
Thank you, Ralph. How about you, Colin?
Thanks, Noel. I think maybe one of the first things to consider is that we have to separate 2 things. One is the tactical response to what's happened over the last few months and understand what we need to do within the portfolio to adjust for being able to get to sites, being able to run trials, and separate that from true rationalization of the portfolio, which is more of like a second step, and kind of really try to separate those discussions from what do we tactically need to do to maintain business continuity, and then also take this very tough time to operate within clinical trials and understand how does that impact what we're able to do over the next 3 to 5 years, and truly do a rationalization that is based on what we want to do and what we want to bring to market over the next 3 to 5 years. You brought up a good point before where don't throw the baby out with the bathwater. I think it's also having some of that discussion, and not just with the putting the ABCs around projects, but also understanding, are there things right now that we want to pull from certain projects that are deprioritized, and then add resource to projects where we see an advantage to bringing something to market faster in the current environment. So I think that rationalization is occurring, and maybe there's two pieces, right? One tactical, one more strategic, but also within the strategic, it's trying to understand how we partition that. Some things, not just around delaying or halting or shelving, right? But then also, what do we accelerate, right? Where do we take that resource that's been pulled off the things that we halt and put it towards things that we want to accelerate?
I imagine most of the people on the panel are at the heart of this. They're the ones doing some of this analysis. How has your life changed? Has the frequency of running different scenarios gone up, I would imagine?
Yeah, I think most of that right now has been focused on the tactics of what has this done, right? How do timelines change? What does enrollment expectation look like, especially with studies that are ongoing or actively enrolling, and now that forecast is completely different. So where does the money go? What quarters, what years does that money need to move to? And then what pressure does it add for the current year or for next year? And then understanding that as a baseline, that's what we now have to deal with. And then where do we actually want to be able to adjust beyond that? So there's a lot of scenario planning. There's a lot of adjustments being made. It's now no longer the monthly discussions around changes. It is daily, weekly, and it is constantly on call.
Yeah, there's no COVID algorithm that you can just hit in your Planisware platform, unfortunately, right? Hey, Michael, how about you at Sunovion? What have you guys conducted a portfolio rationalization? What lessons have you learned?
Yeah, it's been mostly, just like Colin said, it's been very tactical around the impact because we do have a smaller portfolio, and unlike Ralph, we're not working on vaccines or those type of things. So we're kind of, much more looking at the direct impact of the current portfolio, and really, having something like a pandemic hit that we just didn't have in our models because it impacts the entire portfolio, right? It's not only impacting one part versus the other part. Everything is being touched by it. So it's led to a lot of interest, going to your other question around, the data that we have. So we have a lot of interest around the clinical development plans, how those are shifting, how governance is playing a role in changing those. Typically because our lifespan is so long, we tend to make decisions slowly and go through governance in a kind of a slow, very regimented process. But now it's hey, what's the impact of COVID-19? How is that changing things? And like you said, we're getting a lot more questions and a lot more questions around, did every project get updated? So it's kind of an interesting balance between trying to keep to business process and rules around getting governance approvals before you change your timelines versus people saying, yeah, but I need to know the impact.
So far, three of you have highlighted, initially at least, more tactical versus strategic. I imagine you might have gone through a strategy reset, or it's a moving target. The strategy continues to change. So I'd like to hear, let's go to Mike first, or Mel first from Jazz Pharma, and talk to him about conducted a portfolio rationalization lessons learned. But I want to understand how the strategic part, especially when the strategy is changing as we speak.
Yeah, no, just wanted to step back 1 second and touch on the question about the bottleneck. Two thoughts I just wanted to complement to what you had shared earlier, especially someone, leveraging Planisware with the supply versus demand type picture. The two things that I look for to identify that strategic constraint deals with how hard is it to, once the constraint is there, how hard is it to replace it, right? To kind of solve for it. So that's a key piece. And another one, which may seem a little counterintuitive or just silly, but the cost of it. With those two players, that really helps identify for us what those constraints are, rather than what's always under pressure, which may be resources that are easy to replace through CRO and stuff. You may be constantly under bottleneck, but you have easy ways to backfill it. You just put that in the space of how I consider those constraints, bottlenecks that we want to make sure we focus on and quantify well.
Yeah, that's a great point. I think in normal times, we rely on tools like Planisware and PPM systems to have the visibility downstream so we can be more proactive about dealing with that constraint.
Sure.
But when it's dropped in our lap like it has in the last 4 months, that's a different question. It's been all about being proactive and avoiding the reactive resource trading, which is damaging to productivity. But now it's kind of been pulled forward. So that's a great point. So Mel, tell us about Jazz Pharma and the bigger picture.
Sure. So I do want to, as I was thinking your question, I wanted to point out, and it's just being Jazz. I'm new to Jazz. I'm here, a little less than 2 years, and it's been a big growing experience for me to see the difference in a size, the organization size. So with that background, I can share that in early February, we got our priorities and rollout for the year, and in there was 11 objectives that were identified, and they covered a spectrum of things, from very specific launch goals that we had in place to some more corporate development. And so when you think of that, February 7th, by mid-March, March 16th is when we kind of all went to shut down. And before April hit, we actually had a new rollout of priorities. And it was, they took at those 11 priorities and reduced it to 5. And they were still a mix, right? You still had corporate development, although it was simplified in bringing in. So there, there was an interest in that long term. They didn't want to lose that focus on the long term. And they did bring up some things that were more tactical into commercialization in the sense of that near-term dollars. So that there was a shift in those priorities, and then also really narrow down the focus on some near-term dollars, some I think some medium spin type things, and then the idea of bringing in corporate development as an opportunity. And to be honest, I think from both sides, they saw that the market, this may be a good time to identify something that may be struggling from one side, and also keeping an eye for the long term. So that was a shift, and I have to say, having come from historically pretty large players, Merck, BMS, and a PwC consultant, I would have never expected that turnaround in that amount of time in any of those other players. And that just came right from the top, sat down, and they restructured it into a much more focused approach.
Thank you. And how about Robert, our lone med device panelist? Let's, Robert, same question. If
Sure.
At J&J, has your company conducted a portfolio rationalization, and what lessons have you learned from it? But maybe you can provide what's unique about med device versus.
So what's unique about med device is we probably got hit the hardest among all the panelists. So not just not from the product development standpoint, but from the business, we're losing sales, right? Compared to the pharmaceutical companies, people are still taking drugs, but they're not doing knee replacement. Because they're suspended, they can survive without doing a knee replacement at this moment. They can wait, so it's not life-threatening procedures. So from that standpoint, we're under a lot of pressure. So the entire team initially, when the whole thing started, we were like in shock, right? We in shock or / a little bit panic because everybody's just losing a lot of business. That being said, but the leadership team really come together. We look at this whole thing not from the business standpoint, not from the R&D standpoint, but we look at the pandemic itself. Okay, so we have experts around the world. We sit together, look at the thing. Is this thing gonna last forever, for like 200 years? Probably not. It's probably gonna be a short term and a acute event. And are people gonna stop doing the knee replacement after the pandemic? No, they will. People are getting surgeries. People are doing the knee replacement. So that being said, we go back, look at our strategy. Do we need to change anything? Not really. Our strategy is still the same because our portfolio management philosophy is start with your strategy. That's really the foundation of the portfolio management. You have a good strategy, your prioritization needs to be aligned with your strategy. So strategy first, then you prioritize your portfolio against the strategy. You make sure it's well aligned and well communicated throughout the organization. And the last step we do is execution, right? So we pair that together, enabled with the budget management. How do we allocate our money, allocate our resource and investment? So if we look back our strategy is the same, okay? Then we look our prioritization. Well, if the strategy is the same, our prioritization should be the same. So we look at it, we're not going to change our prioritization, but we might do a little bit different in terms of the execution, right? It's actually very easy for us to do, because we always had our prioritization. We have 3 tiers of the project: tier 1, tier 2, and tier 3, right? So, and that was well communicated throughout the organization. Any employee, you ask him, he knows what is our top project. So it's actually very easy for people to execute during the pandemic. For example, where a lot of high-risk areas, or people are not, our employees' safety is our #1 priority, right? So they're not allowed to go into the facility or the labs in certain high-risk areas. Now we're actually sending the lab equipment to people's homes so they can set up the basement lab. So who gets that, right? Then we look at the project prioritization become our guiding star. This is top project. People getting all the resources. We're sending equipment for that team, that employee's home, so they can continue to execute on the critical path for that top program, right? Then later, people doing that at home, then later they can start to access the facility, but we need to maintain the social distance. Which team goes into the facility first, and who gets the most of the time in the lab? Top project. So I guess the prioritization at J&J is not a ad hoc event. It's a routine. We do this on a daily basis. We always have this priority ready. So when things like this pandemic hits, really reviewed how important it is to have a regular portfolio prioritization process around it, and also have a very good system like Planisware to support such activity.